You've probably seen claims online about vagus nerve resets for dogs. A quick massage, some cold exposure, or a special device, and your anxious dog will be calm. Is there any science behind this? Hi, I'm Lyndall from Vetster, and today we're discussing whether a dog's vagus nerve can be reset to treat anxiety. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's get into it.
Let's start with what the vagus nerve actually is. The vagus nerve is the 10th cranial nerve and one of the most important nerves in the body. In dogs, just like in people and all vertebrates, the vagus nerve starts in the brainstem and travels down through the neck, chest, and abdomen. Along the way, it sends sensory and motor signals between the brain and your dog's major organs, including the heart, lungs, stomach, and intestines. The vagus nerve regulates involuntary functions like heart rate, breathing, and digestion. It plays a central role in maintaining normal body function and supporting recovery after stress, which is often called the rest and digest response. Your dog's nervous system has two main branches. The sympathetic nervous system is responsible for the fight or flight response during times of stress. It increases heart rate and breathing while slowing digestion. The parasympathetic system does the opposite. It helps restore balance after a stress response by slowing heart rate, promoting normal breathing, and supporting digestion. The vagus nerve is a key part of the parasympathetic system. When vagus nerve activity is reduced or out of balance, the body may be less effective at recovering from stress. This could contribute to the physical signs we often see in anxious dogs, like a persistently fast heart rate, poor gut health, or excessive panting. In dogs, the vagus nerve helps connect the gut and brain through what's called the gut-brain axis. Early research suggests these pathways influence how stress affects both a dog's digestive system and behavior, but the relationship is complex, and we don't understand it fully yet. The bottom line is that current findings do not show that vagal nerve stimulation is an effective anxiety treatment. So what is a vagus nerve reset? It's an idea suggesting that by stimulating a dog's vagus nerve, owners can quickly calm their pet's nervous system and treat anxiety. Various tactics have been promoted, including ear massage, cold exposure, and something called transcutaneous vagus nerve stimulation, or TVNS, using special collars. Companies marketing these products cite something called polyvagal theory to prove effectiveness. This theory suggests that social mammals evolved specialized nervous system responses to stress. While this theory has been influential in human psychology, it remains debated and is not an established diagnostic or treatment approach in veterinary medicine. Most importantly, there are no peer-reviewed studies or clinical trials showing that any of these techniques or products actually improve fear, anxiety, reactivity, or noise sensitivities in dogs. In fact, DIY vagal nerve stimulation can actually cause harm to dogs. Despite the marketing claims, there's no evidence that at-home vagus nerve reset techniques or consumer devices actually stimulate the vagus nerve or produce any therapeutic effect. However, attempting these methods can create real risks and discomfort. Applying pressure, vibration, or electrical stimulation around the neck or ears may cause pain, skin irritation, burns, coughing, gagging, or difficulty swallowing. Since the vagus nerve influences heart rate, breathing, and digestion, any uncontrolled or inappropriate stimulation could potentially disturb these functions, especially in dogs with heart, respiratory, or gastrointestinal disease. Using ice, cold water, cold compresses, or cold shock methods can cause distress or hypothermia, particularly in small, short-coated, or older dogs. A device or handling that feels strange or uncomfortable can heighten anxiety or make a fearful dog even more reactive. And here's the critical point. Consumer vagal stimulation devices are not approved for veterinary use. Their safety, accuracy, and output levels are completely unregulated. Relying on these unproven methods can delay evidence-based anxiety treatments that actually work. In very rare cases, veterinary neurologists may implant a vagus nerve stimulation device in dogs with severe drug-resistant epilepsy. This involves a specialized surgical procedure. But because this treatment is reserved for carefully selected epilepsy cases, the research data in dogs is extremely limited. These studies don't evaluate anxiety, and there's no evidence that implanted vagus nerve stimulation has any effect on canine anxiety or other behavior problems. Managing anxiety in dogs takes time, patience, and a combination of approaches. The evidence-based treatment typically includes several components working together. Structured dog training programs using positive reinforcement, desensitization, and counter-conditioning help reduce fear and reactivity. Environmental management like predictable routines, safe resting areas, mental enrichment, and gentle exercise make a real difference. Prescription anti-anxiety medications lower baseline anxiety and support learning, and treating underlying conditions that worsen anxiety, such as pain, gastrointestinal disease, or endocrine disorders, is essential. A veterinarian or board-certified veterinary behaviorist can create an individualized plan tailored to your specific dog's triggers, environment, and medical needs. Evidence-based behavioral therapy and medication remain the most effective long-term methods for treating canine anxiety. In-clinic veterinary visits can be stressful and triggering for an already anxious dog. Virtual visits provide a less stressful experience while you discuss your dog's specific challenges with a veterinary professional. If you're concerned about your dog's anxiety, don't fall for unproven vagus nerve reset claims. Talk to your vet about evidence-based treatments. When you're ready, book a virtual appointment with Vetster to discuss what's really working for anxious dogs. Thanks for watching, and we'll see you in the next video.